Hello to you wherever you're listening today on Tuesday, March 9th, 2021. My name is Carla Drysdale, and I'd like to welcome you to today's virtual press conference based at the World Health Organization headquarters in Geneva to launch the biggest ever global study of the prevalence of violence against women. The report contains global, regional, and national estimates for intimate partner violence against women, and global and regional estimates for non-partner sexual violence against women. This press conference is in English only today, with no simultaneous interpretation. Present in the room today here in Geneva at headquarters are Dr. Tedros Adhanom Ghebreyesus, WHO's Director General, Dr. Princess Nothemba Simalela, Assistant Director General, Strategic Programmatic Priorities and Special Advisor to the Director General, will actually be joining us online today. In the room here, we have Dr. Claudia Garcia Moreno, Unit Head, addressing the needs of vulnerable populations, WHO's Department of Sexual and Reproductive Health and Research, and the UNHRP, as well as Dr. Lynn-Marie Sardinia, Technical Officer for Violence Against Women Data and Research, working in the same WHO unit as Claudia. Our online guests are Phumzile Mlambo Nguka, UN Women Executive Director, and Wendy Morton, MP, Minister for the European Neighbourhood and the Americas at the UK's Foreign, Commonwealth and Development Office. And I've already mentioned Dr. Princess Nothemba Simalela, who is also online with us today. And with that introduction, let me now give the floor over to Dr. Tedros for his welcoming remarks.
Thank you so much indeed. Dear Phumzile, the Executive Director of UN Women, Wendy Morton, Minister of for the European Neighbourhood and the Americas at the United Kingdom's Foreign, Commonwealth and Development Office, my WHO colleagues, Dr. Claudia and Lynn-Marie Sardina, dear colleagues and friends, good morning, good afternoon, and good evening, and thank you for joining us for the launch of this very important report. As you know, yesterday was International Women's Day. At our regular press briefing, we celebrated the incredible contribution that so many women are making to the fight against COVID-19 in so many ways. But we also noted that one of the consequences of the social restrictions put in place to suppress transmission of COVID-19 has been an increase in violence against women. Today, WHO is launching a new report that represents the largest study ever conducted on the prevalence of violence against women. I would like to thank UN Women for their partnership through our joint program to improve data globally on violence against women, and I would also like to thank the United Kingdom for the funding it provides for this work. The report includes data from 158 countries on intimate partner violence and sexual violence by a non-partner for women and girls aged 15 years and older. The results paint a horrifying picture. An estimated 736 million women, almost 1 in 3 women globally, have suffered intimate partner violence, sexual violence from a non-partner or both at least once in their lives. And almost 1 in 4 adolescent girls in a partnership have experienced physical and or sexual violence from a partner or husband before their 19th birthday. Globally, women in lower middle income countries suffer disproportionately from violence, especially in Oceania, Sub-Saharan Africa, and South Asia. Violence against women is not just criminal. It has long-lasting implications for the physical, mental, sexual, and reproductive health of women. Injuries, depression, anxiety, unplanned pregnancies, and sexually transmitted infections, including HIV, are just some of the health issues that survivors of violence must live with. The harm done to individual women is bad enough, but the impacts go further, tearing the very fabric of families, communities, economies, and nations. We all lose. This is an old problem, but we can change it. We know what works. We can prevent violence with legal tools by reforming discriminatory laws. We can prevent it with economic tools by strengthening women's economic rights and wages. We can prevent it with educational tools through school programs that challenge gender stereotypes, promote healthy relationships, and provide comprehensive sexuality education. We can prevent it with social tools by challenging social norms that support harmful views of masculinity and condone violence against women. And we can use clinical tools to provide quality care and support for women affected by violence. But the most powerful tool we have is ourselves. All of us can make a difference, women and men. We can all speak up to say that violence against women is never acceptable. We can all teach our kids that violence against women is never acceptable. And we can all treat the women in our lives with the respect and dignity they deserve, and that all people deserve. I thank you. And back to you.
Thank you very much, Dr. Tedros, for those remarks. I'd like to turn the floor over now to Phumzile Mlambo-Nguka, Executive Director of UN Women. Go ahead, madam. The floor is yours.
Thank you very much. Thank you, Tedros, for those powerful remarks and introduction. MP Wendy, Dr. Nono, dear Claudia, thank you so much for this very important work. Violence against women is the most widespread and persisting human rights violation that is not prosecuted, that is also common in every part of the world. We know that from this report and other experiences that we have from our work, that the gender power imbalances play a key role in making this type of violence to survive. We are particularly concerned about the fact that domestic violence has been so entrenched because home is the one place that a woman can find shelter and peace, supposedly. But as we can see, it is not so. And of course, violence against women comes at a high cost to the family, the mental health of the family, the economic health of the family. We know that the cost of violence against women impacts on women's earnings as well as the economies of countries. During COVID, we saw how violence against women increased as women were trapped in the same homes as their abusers. And we want to call on the governments to continue the interventions that were started during the time of COVID in the countries where those occurred, which made it possible for the services critically needed by women who were facing violence to be declared essential services and to be funded in an increased manner. We also had 155 countries. We have rather 155 countries who have now passed laws that are related to domestic violence. We continue to push ahead with that work. It's part of the work that we do in UN Women, supporting member states who are passing these laws. and 140 have legislation also on sexual harassment in the workplace. But of course, the UK and Kenya are amongst the two governments that are leading in that action coalition. And I think we all will truly appreciate this study and will use it so that we can do evidence-based work. We are also thankful to the Secretary General for the role he has played in raising his voice and highlighting the prevalence of violence against women in the world. And that has elicited some response amongst member states. But again, we need to see real implementation and sustained interventions in response to the Secretary General's report, as well as hopefully in response to this report, we will see more countries taking decisive steps. Once again, thank you very much. Thank you, Claudia, for this excellent work. Over.
And thank you so much for those remarks, Phumzile. We'll now hear from Claudia Garcia Moreno of the WHO, who will give an overview of the key findings of this report.
Interesting, this very important and sadly very persistent problem that affects so many lives globally. Behind these numbers are women, our families, our human suffering, a lot of human suffering. The report, as has been mentioned, is based on a very comprehensive and systematic review of all available data on the prevalence of these two forms of violence collected between 2000 and 2018. That was either publicly available or was made available to us by countries. And these are the first internationally comparable estimates during the Sustainable Development Goals reporting period. We believe they provide us with a robust baseline against which we can track progress as we move forward. The numbers are stark, and we have already heard some of the headline. I will repeat first the combined estimate for the two forms of violence that we are measuring, physical and or sexual violence in the hands of a partner or sexual violence in the hands of non-partner, remains stubbornly around the 1 in 3, 30% of women 15 years and older. The vast majority of this violence is violence by a former or current husband or intimate partner. Over 1/4 of women who have ever been partnered over the age of 15, 26% have been subjected to either physical or sexual violence by a partner at least once of their lives. And as we've heard, sadly, this violence starts early, affecting already 1 in 4 adolescent girls and young women. When we look at current or recent violence, which is measured by asking in surveys about whether this happened to you in the past 12 months, we find that 16% of young women between the ages of 15 and 24 have experienced current or recent violence, so violence in the past 12 months. Globally, 1 in 7 women are experiencing violence recently or currently, 13%. But this global figure hides very stark differences between high-income countries and low and middle-income countries, where women often have limited access to the economic and the social support that they need to leave abusive relationships. The prevalence of violence, intimate partner violence, is unacceptably high everywhere. But as you will have seen and as has been noticed, there are important differences across regions and across countries. And we have around more than 30 countries where the lifetime experience of this violence is higher than the global average. It can reach higher than 30% and even as high as 52%. That means 1 out of every other woman is experiencing abusive relationships. So while intimate partner violence remains the most prevalent form of violence against women globally, also we documented that 6% of women and girls globally have been subjected to sexual violence by someone other than their husband or partner. The true prevalence of sexual violence is likely to be much higher. While we have seen more women disclosing thanks to movements like Me Too or Stop the Blame and others, the issue remains highly stigmatized, and many still fear the blame and the repercussions if they speak out. I know that this report presents a very bleak picture, and that the numbers are very shocking, even for those of us who, in a way, are not surprised by them, but are still shocked by them. But I also do want to highlight that there is progress. Firstly, we have almost double the number of countries than we had in our previous estimates that were published in 2013 that have at least one survey in the last 18 years measuring this form of violence. And while the data is not perfect and there is room for improvement, naming and counting the problem is often a first step for action and for dialogue at both the policy level and in society with the general public. Secondly, and has already been mentioned by Phumzile, we have around 155 countries that now have laws on domestic violence. We want to see them fully enacted. Thirdly, we know much more about how to prevent violence against women than we did even 5 years ago. And a call out to a UK government-supported initiative called What Works to Prevent Violence Against Women and Girls that in the past 5 years has supported research and rigorous evaluation of more than 18 interventions in different countries. So we now have a menu of interventions that we know are promising or effective in reducing, particularly intimate partner violence, not in decades, but within years. And we need to really expand these and scale them up. Some have already been mentioned, school-based programs, community mobilization programs around changing gender norms, and particularly changing norms around the acceptability of this violence, cash transfers that were not designed or intended for reducing violence against women have been shown to have an impact in reductions of violence, psychological interventions to support survivors. So we have a much bigger understanding of both what works to prevent and what do we need to do in terms of services. And we need to work hand in tandem in both prevention and ensuring that those who are already suffering these situations have access to survivor-centered services and comprehensive services, and that we have a joined-up, multi-sectoral, coordinated response. Specifically in relation to the health sector, countries in all regions have been adapting WHO guidance and tools for strengthening the health system's response. And even in high prevalence countries like Afghanistan or the Democratic Republic of Congo, we are working closely with the ministries of health to develop national protocols. Thousands of healthcare providers have been trained. And clearly this is not enough and needs to go hand in hand with changing norms. At the same time, health services are often a safe place for women to go to and can be an entry point for other sources of support. In other countries, we have been able to integrate the response to violence against women into UHC packages. So to conclude, we have a glass half full, glass half empty situation. We have come a long way. Clearly, we still have a much longer way to go. There is a lot more awareness and recognition of the problem, and also more knowledge and evidence around solutions. We really hope that these numbers will shock us all, governments and other actors, and as the DG said, all of us, because we can all play a role, into acting with more urgency, into reaching those commitments that we have already made in our different capacities, and really accelerating action to be able to get close to achieving the Sustainable Development Goals, particularly around the elimination of all forms of violence against women and girls. Thank you.
Thank you so much, Claudia, for those remarks. I'd like to turn the floor over now to MP Wendy Morton from the United Kingdom. And please note that Ms. Morton will need to leave the press conference after her remarks. Over to you, Ms. Morton. You have the floor.
Thank you. Thank you so much. I'm pleased to be able to be with you here today to draw much needed attention to the powerful findings from this new report, which provides yet further evidence that violence against women and girls remains one of the most widespread human rights violations of our time. I'd like to thank the World Health Organization and UN Women for their leadership in generating this rigorous data as a global public good. It reveals the persistent magnitude of violence against women around the world. I've been deeply concerned by the surge in violence during the pandemic, including here in the UK. But as we have heard, even before COVID-19, violence was at epic levels. We know there is a risk that once the media spotlight moves on from COVID-19, some will wrongly assume that the violence has suddenly stopped. It's therefore vital that together we sustain a long-term approach to stop violence before it starts. Despite the scale of the problem, we now have rigorous evidence to show that we can prevent this violence, and it does not have to take generations. The UK-funded What Works to Prevent Violence programme has shown that interventions tackling values and behaviours at homes, schools and communities can achieve significant reductions in violence of around 50% in a few years. Building on this success, this year, the UK will be launching the first ever global effort to increase implementation of proven violence prevention approaches through our What Works to Prevent Violence Impact at Scale global programme. I feel proud to be part of a government that is recognised for its global leadership on violence against women and girls, but I'm not complacent. We have a long way to go to tackle this abuse, and the UK remains steadfastly committed to working with the WHO and UN Women to eliminate violence against women and girls. That is why the UK is co-leading the new Generation Equality Global Action Coalition on gender-based violence, along with other fantastic partners. We're using this platform to drive more concerted, coordinated and scaled up global action to address violence, sharing our evidence from What Works to encourage a data and evidence-based approach. As we've already heard, the new data has reinforced the reality that adolescent girls are particularly vulnerable to higher levels and multiple forms of violence. Tackling this will be a focus of the Action Coalition. Together, we must get to the root of the issues. We have to change the way that society values women and girls, ensure they have access to quality education, health services and opportunities, and make sure that their rights are respected and realised. It's a hard task, but we know it is possible. The shocking estimates released today must serve as a further call to action for us all, but we will not be deterred by the scale of the problem. We now have the evidence that violence is preventable, and we know what approaches are effective. Together, we have the opportunity and the responsibility to translate this evidence into long-term prevention. And I'm resolutely determined that the UK will continue to play its part with others in driving down rates of violence against women and girls so that no woman has to live in fear of violence, and so every girl grows up knowing she is safe. Thank you.
And thank you, Ms. Morton, and to Claudia Phumzile and Dr. Tedros for all of your remarks addressing violence against women. So let's now transition to questions from the media. For journalists who wish to pose a question, can I ask you to please use the raise the hand icon on your screen, and remember to unmute yourself. And please stick to one question, and let's get started. I'd like to first call on, hang on. Paula Dubias from the New Humanitarian in Geneva. Paula, are you online? Could you unmute yourself and go ahead, please?
Yes, thank you for taking my question. I had a question about the data collection. In Latin America, to take one example, there's there's serious issues about the collection of data, which is very often uneven or inexistent. There are no registries. Of course, as we know, there are already issues with people coming forward to report their violence. And I'm just wondering if this doesn't send a wrong message to countries that perhaps they may not be doing as badly as the report says. Also, there was a report last week by CARE that said that the UN agencies are not doing enough to ensure the safety of women and girls, and that there are a lot of proclamations about having to move forward, but that in essence there's not enough real action that's being done by the agencies.
Thanks very much, Paula. I think we'll have Claudia address your question.
These estimates are based on data that comes from surveys or studies conducted in countries and that were either publicly available or were made available to us by countries. And the estimates that we have at the moment, we think, are fairly robust, and they are as robust as we can have them with the current existing data. There are, of course, many opportunities to improve the data collection, as you rightly point out. And this is precisely one of the purposes of the joint UN Women and WHO program. It has a component of capacity building, which is being led by UN Women, and we have had a couple of regional workshops already. And one of the interesting outcomes of the country consultation has been this interaction with national statistics offices or health departments or whoever is responsible for collecting this data to think of how we can strengthen data collection and how we can strengthen data, administrative data from police or health or other services. So there are challenges with the data, and it is one of the elements that we will continue to work on, is to build capacity and to strengthen the measurement and the collection of this data.
Thanks very much, Claudia. Next on the list, we have Sophie Mokena from SABC. Can you hear me, Sophie?
Yes, I can hear you loud and clear. I just want to find out from the UN UN Women Executive Director, Dr. Phumzile Mlambo-Ngcuka. Dr. Phumzile Mlambo-Ngcuka, you did launch a campaign, He for She, where you encouraged heads of state and government to support the campaign in a fight against this pandemic some years ago. How far are you in terms of the support from the heads of state and the commitment from political leadership to deal with this pandemic?
Phumzile, would you like to take this one?
Yes, I will. Thank you very much, Sophie, for that question. The 10 countries and head of states that were part of the He for She leaders multiplied into about more than 30 countries that have participated. In most of those countries where we have a He for She champion, we have worked on the police, making the police more gender responsive. We have created training opportunities for the police. As a matter of fact, in the last 2 weeks, we're launching a handbook that we have designed together with the law enforcement agencies that is helping to sensitize and to train and to create the manual standard procedures for dealing with crimes against women. But I cannot say that that has created dramatic reduction of violence against women. It has created more commitment, more efforts in those countries. And we are hoping in the work that we're going to be doing in generation equality, these are some of the countries that we're going to zero on. Or we've also moved in those countries when it comes to passing laws. Almost all of them have passed and adopted laws that address violence against women.
Thank you, Phumzile. I'd like to now move to Antonio Broto from FA. Can you hear me, sir?
All right, a global study of the prevalence of violence against women, of course, it's a report being released by the World Health Organization, and we have heard journalists now asking questions here to that. And we have come to the end of our program this Tuesday evening. Thank you so much for joining us, and the view continues after this. Goodbye.
There's never been a better time to see if you can save on your car insurance with Outsurance. Here are some happy people who've done just that.
100% know. The guy knows his stuff. I end up saving over 700 rands per month. If you want a happiness in your pocket, change it right there.
If you think you may be paying too much for car insurance, call or SMS Outsurance now. They'll either save you money on your car insurance, or you can ask them for 500 Rand. Being claim-free and with the same insurer for 3 years? Tell them you want 1,500 Rand.
The team at Outsurance were just amazing. They were friendly, and then when they told me what my premium was, well, you could have picked me up off the floor. It was just such a massive saving. 815